I'm here with Luca Gualdi. Luca, you presented a really interesting thing. You presented a presbyopia treatment, an ab externo treatment with a contact lens. Can I get you to sort of walk me through this?
Yes, it's a treatment based on a rigid contact lens. It's a scleral contact lens made in polycarbonate by 20 millimeters diameter. And the contact lens is in direct contact with the bulbar conjunctiva and no contact to the cornea. So the treatment is not invasive for the cornea. And from the core of the contact lens, there is a connection by cables to an electrostimulator connected by male-female jacks. And the electrostimulator erogates square wave biphasic microcontinuous current, which activate the muscle with a passive induction of stimulus with a contraction of 2 seconds of contraction followed by 6 seconds of rest. And the treatment lasts almost 8 minutes per eye.
So let me picture this. So this is a contact lens with electrodes coming from it. The electrodes rest on the bulbar conjunctiva anterior to the ciliary body.
Yeah.
You are stimulating through this tissue the ciliary body at intervals over an 8-minute period. So it's not that the contact lens is what's going to, it's not that the patient has to wear this contact lens after treatment. This is something that's done during treatment, and then after this 8-minute treatment the patient is discharged. And the idea is to stimulate, to exercise the ciliary muscle.
Correct.
So I'm very eager to ask how well this works, but let me ask something first, which is, what is the typical treatment protocol? So it's an 8-minute treatment protocol. When does the patient get treated next? What's the treatment pattern?
Yes, as a passive induction of stimulus, it's like an exercise, as you said. So you have to treat the patient not only one time, of course, but you have to maintain trained the muscle. So you have to treat the patient once and then wait almost 10 to 15 days to treat another time, and you have to activate the muscle. Once it's activated, with the results on near vision intermediate visual acuity, it means 2 or 3 treatments. You can follow the patient and treat only once every 3 months to maintain the effect. So the treatment is made by one activation dose and then followed by maintenance dose, almost one treatment every 3 months.
Look, I'm going to ask 2 questions. Number one is, what were your results of your study looking at these patients? How much accommodation could they perform after treatment? And question 2 is, are there particular demographics, particular sorts of patients who benefit more or benefit less from this sort of treatment?
Yes, we saw that the treatment can give good results on near and visual acuity, and the best patient has to be no more than 1.25 plus 150 of near correction, because if you have more, the effect is very low, and the people is already use near vision glasses, and the treatment cannot give the same results because they are used to use glasses. So the best patient is between 40 and 50 years old with early presbyopia, even if because the crystalline lens increase more and more the weight during the aging, so the ciliary muscle needs to be stimulated with more power to contract more the lens, because we know that the main cause of presbyopia is the lens and not the ciliary muscle.
Yeah, I was going to ask that this sort of treatment seems to run contrary to what the current thinking is, which is that the problem has to do with rigidity of the lens, not increasing weakness of the ciliary muscle. What you're doing in this treatment is just trying to get the ciliary muscle to the point where it can overcome this rigidity. And from what you tell me from the treatment protocol, it sounds like after the first 3 or 4 treatments, this stimulation period, that the duration of effect of subsequent treatments is about 3 months.
Almost 3 months, but it's very different from patient to patient because there are people from 40, 43 years old that react better and you need every 4 months. Or there are people from 49 years old that needs every 2 months. So it's an average 3 months. You have to see the response and then decide with the patient the best program customizing for him.
So how much, and I'm sure that the answer obviously is going to be that it's going to vary a great deal by the patient's age, but how much accommodative amplitude increase do you think that you're getting from this?
Yeah, we saw with several exams best focalization of the nearest point with the Duane test by 6 centimeters of nearer. And we saw almost 1 character with logmar at 40 centimeters and intermediate vision at 70 centimeters, only almost 1 character. And also they increased their reading speed time and they could read more words in a minute. And also they increase their vision in dim light conditions and contrast sensitivity. We saw the patient also barometrically speaking because we saw a negative spherical aberration which is more pronounced after the treatment in maximum accommodation. We also found the UBM a useful tool to see what really happened after the treatment, and we found an increasing of the lens thickness by almost 0.10 millimeters and decreasing of the posterior ray of curvature and especially of the anterior ray of curvature by almost minus 0.2024. And this is the reflection on the best near visual acuity and the results.
Does this treatment change the patient's manifest for distance? I mean, is it? I just want to make sure that it's not the case that you're inducing this tremendous ciliary muscle tone that the patients are myopic after treatment.
Absolutely not. We did it also in low hyperopics and we found they increase their vision for far. But absolutely doesn't induce any aberrations for far vision because the treatment only for near vision induce better results. And we treat also post LASIK patients with no problem on the flap. Because these patients are the very demanding patient because they was treated almost 15 to 20 years ago, and they for all the rest of the life they saw very good for far, and when they drop the 40-45 they start to don't see better for near vision, so they want something more. They ask for re-LASIK, retreatment, enhancement. But with this treatment you can leave the same far vision, restoring the accommodation lost during the first aging of their presbyopia. Of course, this is the best demanding patient, and you can offer something without induce something more on their cornea or on the lens, which is definitive and with more side effects, because you speak about surgery which works on pseudo accommodation and not really on accommodation like this treatment that is not invasive, and it's not in competition with the others because work in another completely different manner.
Luca, this contact lens has a tremendous vault, so that there's no contact with the cornea. Essentially, this is really something that's resting on bulbar conjunctiva. Having said that, did you look at corneal safety with this device?
Yeah. There is no corneal damage. It's very important to remove the contact lens carefully to don't damage the epithelium, of course, and to treat the patient with artificial tears for 1 or 2 days, because for 8 minutes he remained with the eye lash open. So after cataract or LASIK surgery, you have the speculum and the eye can be more dry. So it's good to leave to the patient artificial tears. But no damage to the cornea, no induction of crystalline lens dysfunction. We studied with the Scheimpflug camera and we didn't find any opacity, or with the Tracy system we didn't find any dysfunctional lens index change between before and after the treatment.
Luca, this is really, really cool stuff. I'm really happy that you brought this topic to us. It's really neat. I want to thank you very much for being so generous with your time with us today. Luca, molto grazie.
Thank you, grazie a voi.